Hi friends, welcome to Plexus Ortho. My name is Dr. Kanan Kumar. I am an orthopedic consultant at Plexus Ortho. Today we are going to go through one of those questions that we put up in the Telegram channel a couple of days ago. The question is as follows. It was MCQ number 219. It goes, which is the most common primary malignant bone tumor? So metastasis is the most common tumor in the bone, but however it is not a primary malignancy. It is from some other tissue like the prostate or the breast and etc. So therefore metastasis is not the primary malignant bone tumor. Among osteosarcoma, chondrosarcoma and synovial sarcoma, osteosarcoma all of us know is the most common primary malignant bone tumor. So this you must all remember very well. Is one of the most common primary malignant bone tumors. It's very common. It's the most common tumor in the second decade of life. It's the most common tumor in the second decade of life. A common benign bone tumor. The most common benign bone tumor is an osteochondroma or exostosis. Right? Which is the most common malignant bone tumor. If it does not say primary bone tumor, then it is metastasis. So these most commons you must understand very clearly. You must be able to replicate, very often asked in the exam. Which is the most common benign bone tumor? The most common benign bone tumor is osteochondroma. Most common malignant bone tumor is metastasis. Most common primary malignant tumor is the osteosarcoma. Now coming to secondary osteosarcoma, we know that the primary osteosarcoma arises de novo from the bone, but a secondary osteosarcoma arises from a pre-existing condition. It arises from a pre-existing condition. It arises from pre-existing condition. What are the pre-existing conditions that can occur? It occurs in the later age group from Paget's disease. So because of a high turnover in the bone formation and absorption, at some point something goes wrong and an osteosarcoma can occur. Olier's disease, it can occur. Olier's disease, the multiple enchondromas. Maffucci's disease, almost 100% malignancies change, and some of them turn into osteosarcomas. Multiple hereditary exostosis, there is a 1 in 10% chance of one of the osteochondromas or exostosis becoming a secondary osteosarcoma. Radiation induced osteosarcoma can occur as well. So prolonged radiation at a particular point can also occur and can also stimulate or instigate formation of osteochondromas. So these are all secondary osteosarcomas. Paget's disease, multiple hereditary exostosis, radiation, Olier's disease and Maffucci's disease. In multiple hereditary exostosis, the chance is 1 to 10%, whereas if it is a solitary osteochondroma, the chance for conversion to osteosarcoma is less than 1%. What is the histopathological appearance of osteosarcoma? It is basically made up of lacy appearing tissue, lacy appearing material, glossy appearing material. It is immature bone is formed, that is woven bone or immature bone is formed, and there is mitotic changes, atypical mitosis, necrosis and hemorrhage. So basically when you see improper osteoid formation with lacy features, glassy appearance, it indicates it's an osteosarcoma, it's an immature osteoid or immature woven bone formation, right? It is mostly metaphyseal. Osteosarcoma occurs in the metaphyseal region. It's a bone forming tumor, and 50% have already had micrometastasis at the time of diagnosis. What are the types of osteosarcoma that we know of? We have the intramedullary or the classic version, which happens in the intramedullary region. Then it bursts out and becomes extracompartmental. Then we have the periosteal, which is predominantly in the periosteal region, right? Then we have the paraosteal, which is like a stuck-on appearance, or it happens in the posterior aspect of the distal femur. This is a paraosteal example. This has the best prognosis. So among all the osteosarcomas, which has the best prognosis? P-A-R-O, paraosteal osteosarcomas have the best prognosis. Where does it occur? It occurs in the distal femur on the posterior aspect, where the stuck-on appearance of the osteosarcoma. The other type of osteosarcoma is a telangiectatic or hematogenous appearance of the osteosarcoma. This can become confusing with a giant cell tumor and along with an aneurysmal bone cyst. So differential diagnosis for a telangiectatic osteosarcoma is an aneurysmal bone cyst or a giant cell tumor. What are some of the radiological signs that we can see? We all know this very commonly. It's called the Codman's triangle. That is an elevation of the periosteum from the bone, it is called, and because of the growth of the tumor, is called as a Codman's triangle. Then sunburst or hair on appearance can also happen with osteosarcoma because of the rapid growth of the tumor. Both these things are not very specific for osteosarcoma, but in a combination of all these things seen in the bone can indicate towards osteosarcoma. So the two most common radiological signs are Codman's triangle, sunburst appearance, or hair on end appearance. Okay, so what is the treatment of these osteosarcomas? The treatment is basically, first you start with neoadjuvant chemotherapy, about 4 to 6 weeks, and then you go on for surgery. So what basically the chemotherapy does is it debulks the tumor. It also reduces the micrometastasis and chance of metastasis. Then you do some kind of surgery. It could be a salvage, limb salvage, or an amputation kind of a surgery. Once the surgery is done, further 4 to 6 cycles of chemotherapy is given. These tumors are not radio sensitive, and therefore radiotherapy is not a good modality in treating these cases. So you don't have to remember, as far as I understand, in the NEET PG they don't ask for the exact drugs that are used in osteosarcoma. They ask what is the plan of treatment. So therefore you give neoadjuvant chemotherapy, debulk the tumor, then do some kind of surgery. It could be salvage surgery, it could be salvage, or it could be an amputation, and then you again give chemotherapy. So this is neoadjuvant chemotherapy. So this is the protocol that is followed. It is different in different centers. The drugs which are used are different. So that should not be your concern. What you should know is, first you do a neoadjuvant chemotherapy, surgery, then followed by chemotherapy, right? So which is the most common primary malignant tumor of the bone? It is osteosarcoma. Which is the most common benign bone tumor? It is osteochondroma or exostosis. Which is the most common primary tumor of the bone? It is metastasis. So these are the things that you must know, most common things in bone tumors, and this is very commonly asked. So that was in brief about most common tumors in the bone and a little bit about osteosarcoma. We will go into a little more detail in other videos. Thanks for hearing me out. My name is Dr. Kanan Kumar, and this is Plexus Ortho. Thank you.